Mom, can I go to the hospital to see my friend? His mother said he was hospitalized due to a severe fever.
Of course you can.
Hi, madam. How is his condition?
He is stable for now. You can see him if you want to.
Sure. So how are you feeling now? I'm feeling a little bit better, but I still feel dizzy and having a back pain. I see. Well, you should rest. I'm gonna go and sit with your mother. See you later. Get well soon. Thanks for coming.
Have you seen Madam Hilda? I want to talk about Mike's condition with her.
She went to the toilet. She should be here soon.
Right.
By the way, may I ask you a few questions about the dengue fever? I'm quite interested in this topic and planning to include it into my biology assignment.
Sure, I suppose I can spare some time. What do you want to know?
I want to know how the disease being diagnosed.
Well, first the doctor should obtain the patient's history as much as possible, such as their latest travel history, last meal and complaints. After evaluating the patient's history, the medical professional will decide the type of diagnostic method to be used.
I see.
The method can be classified into two categories, which are virological and serological method.
Can you emphasize more on that?
Of course. The virology method is used to detect the presence of virus particle or proteins that are produced by the virus. This method is usually done by using reverse transcriptase polymerase chain reaction. This test provides the most accurate and reliable diagnosis, but it's quite expensive. Virological method also can be carried out using rapid test kits to detect some proteins that are produced by the virus. Serological method, however, is used to detect the presence of antibodies against the dengue virus. One of the most frequently used tests for this method is enzyme-linked immunosorbent assay.
Interesting. How about the treatment of this fever?
Unfortunately, dengue fever has no specific treatment. It almost solely depends on our immune system to fight the virus. However, we can take some medication such as acetaminophen or paracetamol to relieve the symptom of headache, fever, joint and muscle ache. You are advised to rest as much as possible and drink plenty of water to stay hydrated.
How about taking aspirin or ibuprofen?
You should avoid from taking those medications without a prescription from a medical professional, since it has the possibility of worsening the bleeding complications.
Oh, I see. Well, thank you for explaining it to me.
Sure thing.
There she is.
All right. I'm gonna talk to her right now. I would like to discuss about your son's condition.
No problem, doctor.
Let's go into my office.
Is everything okay, doctor?
Well, I decided that I want to keep him here for tonight just to be sure that his fever is under control.
Of course, doctor, if that's for the best.
All right. By the way, I want to give a little of advice about the prevention of this fever, if you don't mind.
Sure.
In the future, in case you suspected you have the symptoms of dengue fever, you must avoid yourself from getting more mosquito bites, as the virus may still be present in your bloodstream and possibly transmitting the virus to an uninfected mosquito. In order for us to prevent the mosquito reproduction, we are advised to ensure any container used for water storage is tightly covered. Throw away unnecessary materials that can accumulate rainwater, such as tires, food containers, etc.
I will do as you said, doctor. Thank you.
You're welcome.
Hi, son. The doctor said you're gonna need to stay here tonight.
Sure, Mom. I hope I'm gonna be fully recovered by tomorrow.
I hope so too.
By the way, does this mean that we can't go to visit Malaysia again?
Of course we can. But next time we're gonna be more careful and prepared.
I can't wait. Well, I think I'm gonna sleep and have a rest. You should too, Mom.
All right, sweetie. Good night.
Good night.